America. It is 18 pages long, but does not include details that governors have asked for, like how to ramp up testing or expand contact tracing. Ben Tracy is at the White House tonight. And Ben, so what do these guidelines say?
Well, Nora, the president has gone from claiming absolute authority to telling governors on a phone call today that, quote, you're going to call your own shots. Now, these new guidelines, these are just advice, but they basically say before a state can think about reopening, it needs to be on the downslope of coronavirus cases. It needs to be able to test its healthcare workers, and its hospitals cannot be in crisis mode. Several governors are extending their stay-at-home orders, but President Trump is pushing ahead with his plan to reopen the country.
We're opening up our country, and we have to do that. America wants to be open.
In states that enter what the president's guidelines call Phase 1, the vulnerable still stay at home. People should avoid groups of more than 10 and minimize non-essential travel. Schools and bars remain closed. Restaurants, churches, and gyms can reopen with strict physical distancing protocols. Employers are told to encourage telework and return employees in phases. Only once a state does not see a rebound of infections should schools reopen in Phase 2. Backlash to stay-at-home orders is building as a staggering number of Americans, 22 million, have now filed for unemployment in just the past 4 weeks. In Nevada, the coronavirus outbreak has spread an eerie silence over the Las Vegas Strip for nearly a month. Mayor Carolyn Goodman calls the continued shutdown total insanity.
We're ready to reopen right today. We had 300,000 that filed for unemployment when there are probably 900,000 out of work.
But the country still lacks a widespread and reliable system of testing and tracking, and the president's guidelines leave that to the states. Business leaders have told President Trump that's essential before Americans will feel safe returning to work in stores. And the president's own health experts say Americans still need to keep their distance.
To all of you that are out there that would like to join together and just have that dinner party for 20, don't do it yet.
Now, a source on that call with the president today says that the president seemed more concerned about businesses, protecting them, getting them open, than making sure that states have this crucial testing in place. Nora.
All right, Ben, thank you.
This one, known as the detector, doesn't need
a less than 40-minute turnaround time.
Dr. Charles Chu of UCSF is a scientific advisor to Mammoth. He is currently validating the test.
We want to make it a single reaction that can be run in a tube, and we want to make the readout as simple as a urine pregnancy, similar to a urine pregnancy test where you would have a color change that would show whether or not a patient was infected.
Alan Martin, CBSN Bay Area.
A San Francisco Bay Area biotech company is now in the spotlight. Its drug to treat COVID-19 patients shows promise. But some experts are not celebrating just yet. It is called remdesivir. It's an antiviral drug made by Gilead Sciences. Researchers at the University of Chicago conducted a trial with 125 patients. Most were severely ill. And while 2 patients did die, healthcare publication Stat News reports most improved so quickly they were discharged from the hospital in less than a week. Now, despite the encouraging news, one UCSF doctor is urging caution about any experimental therapy.
I think it absolutely offers potential hope, but I think we also have to be careful to not conclude that because somebody got a particular drug and had a good outcome, that it means that the drug was responsible for the good outcome.
With U.S. health officials cautioning that a vaccine is 12 months away at best, quickly finding an effective treatment is critical. Investors clearly liked what they heard. Shares of Gilead Sciences spiked by more than 16% in after-hours trading. A drug used in organ transplants could help combat complications from coronavirus infections. That drug is currently used to fight rejection in transplant patients. Now, one doctor says it could also stop life-threatening lung damage in COVID patients.
I think you can envision a scenario where cyclosporin is actually used to block COVID-19's kill mechanism by really dampening the hyperimmune response that leads these patients to get into the ICU and into critical illness.
And the doctor hopes to start clinical trials soon. There is no shortage of the drug right now. Nurses across the nation are coming together to help out their own. They're flying to the hardest hit areas to volunteer. One pilot fought back tears after he learned some of those nurses were on his flight. CBSN's Chris Van Cleve shows us the moment of gratitude.
I really, really appreciate and thank you for what you are willing to volunteer to do.
With his voice cracking and his mind on his wife Debbie, a nurse, United Airlines Captain Jim Crail wanted to say thank you.
We have quite a few folks who are going to get on this airplane to travel down to the tri-state area to volunteer to help as medical professionals. I'd like to ask all of you, would you please stand up? I know my wife would be totally embarrassed if I asked him to do that.
A cell phone recorded as he thanked some of the 15 who had volunteered to go to New York to help treat coronavirus patients.
Here are these people that are willing to risk everything to go to New York to be able to help sick people in a time of dire need.
Thank you to these heroes going to do this in New York City.
United and other carriers are giving free flights to medical personnel, including this group of 20 volunteer doctors and nurses from UC San Francisco Medical Center who went to New York Saturday.
Just the simple act of saying thank you meant a lot to people.
That was what it was for me. Now that it's out, it goes to every one of those people who have been willing to run towards the danger instead of away from it.
People worthy of all the thanks you can fit into the biggest airliner you can find. Chris Van Cleve, CBS News, Washington.
Coming up, reshaping the world of sports, how some leagues are adapting to life during a pandemic. You're watching CBSN.
Hey, it's Ian Armitage from Young Sheldon.
This is Annie Potts.